Okay, today we are going to see about endodontic flareups. Okay, in that we are going to see definition of the same, occurrence, incidence, causes that are etiological factors, hypothetical mechanisms responsible for pain and swelling, microorganisms as causative agents, apical extrusion of the debris, changes in endodontic microbiota. Microbiota is nothing but the microorganisms present into the canal. Secondary intraradicular infections, increase in redox potential, alteration of local adaptation syndrome, changes in periapical tissue pressure, effects of chemical mediators, that is cell mediators, plasma mediators, and introduction. Immunological phenomenon, physiological factors, then prevention and treatment of the mid-treatment flare-ups. In that we are going to see during the endodontic treatment, relief of occlusion, relax the patient, cleanse and shape, calcium hydroxide therapy, intercanal medicaments, to leave or not leave teeth open, surgical management, antibiotics and analgesics, NSAIDs and corticosteroids, one appointment endodontics, and later we are seeing the references for the same presentation and the conclusion about this presentation. Okay, now we'll see the definitions. According to JOE, it defined as a pain or swelling that requires an unscheduled patient visit and active intervention by the dentist. Okay, there are many of the definitions that you will get into the books, but according to JOE, I have told you, another you will get into your books. Okay, incidence of the mid-treatment flare-ups. According to Engel, incidence of the mid-treatment flare-ups are 21%. According to Klim, 25%. According to Salzer, that is 40%. 1.4 to 16% according to Morse et al. Okay, etiological factors. Etiological factors is nothing but the cause of the disease, that is known as etiology. In that, well, according to Cohen, inadequate debridement. Debridement is nothing but the removal of the debris. Debris extrusion. Debris extrusion is nothing but the extrusion of the debris through the apical region to the periapical area. Over instrumentation. Over instrumentation means you are using your intercanal instruments for more than required time or more than required. What we say, if they are required less, you are using more. That is known as over instrumentation. Overfilling. Overfilling is nothing but when your gut aperture points extrude the apical foramen. That is known as the overfilling. Retreatment. Retreatment is nothing but you have heard about the RCT, that is a re-root canal. Due to any factor, there are many factors for the retreatment. That retreatment and the periapical lesions. Periapical lesions are nothing but the accumulation of the pus cells at the apical area. There are to form the periapical lesions. Okay. In that, first we are going to see inadequate debridement, that is failure to remove the total debris. Presence of residual pulp tissue allows bacteria and the toxin to remain in the root canal and act as the irritant. Teeth with necrotic pulp are more prone for mid-treatment flavors than the vital pulp. Teeth which are present with the necrotic pulp, they contain the various bacteria. Bacterial load is more in the root canal of the necrotic pulp canals than the normal or healthy pulp canals. Now you will say that if there is a normal and healthy pulp, what is the reason for root canal treatment? But there are many factors such as small caries or fracture of the tooth, or non-carious lesions such as average and at region. These requires special attention and they require the root canal treatment. So this teeth need the root canal treatment. Though the debridement is the goal for initial management of the teeth. Okay. And the debris extrusion, despite good control of the length of the instrument, pulp tissue fragments, necrotic tissue, microorganisms, dental fillings, and canal irritants are extruded beyond the apical foramen, leading to the mid-treatment of the post-treatment pain. Excuse me. Okay. Debris extrusion is a problem with all the techniques of the instrumentation, but crown down and balance force technique have been shown to extrude significantly less debris than the step back filling techniques. Okay. Over instrumentation. Over instrumentation that I have told you, gross over instrumentation may cause acute apical periodontitis, producing the inflammatory pain. Overfilling, extrusion of sealer or gattapacha into the periapical areas may lead to higher incidence and degree of pain than teeth with one shot of obturation. Extrusion of sealer or gattapacha. Sealer is nothing but the material used to seal the gattapacha to the canals, and gattapacha you know as well, it is an obturating material. If the overfilling takes place, it gives continuous irritation to the apical area, and hence the mid-treatment flares or pain to the treatment during the treatment can cause. Permanent nerve damage can occur because of the chemical toxicity of the extruded material and also mechanical nerve damage, that is paraformaldehyde. In many of the cases, you are using the various irrigating materials. If that irrigating materials extrude beyond the apical area, it may cause many of the this one pain during the treatment. Then one appointment exam, most patients experience little or no pain after single visit root canal treatment. Only 2% have severe pain. Retreatment. Most of the cases have a higher incidence of flare-ups. These cases are associated with periapical pathosis and that increase the likelihood of the flare-ups. These cases are most difficult to treat and time-consuming with an increased change of heterogenic mishaps. Periapical lesion, apical radiolucencies are associated with the increased flare-ups. Also, teeth with intact periodontal ligament, there is development of pressure after inflammation develop, and so the area becomes more painful. Host factors, patient with dental phobias, patient age, sex, presence of allergies, tooth position, systemic diseases have shown both positive and negative correlations. Hypothetical mechanism responsible for the pain and swelling. Microorganisms as causative agents. Apical extrusion of the infected debris, one of the principal causes, according to Selzer and Nedroff and Sequira, change in the balance, heterogenic over-instrumentation, increase in the influx of blood and extrude into the root canal. Excuse me. How was it? Okay. During chemomechanical procedures, may induce acute periodicular inflammation to re-establish the balance by aggressive and defense. Hello. Microorganisms as causative agents. Secondary interradicular infections are infections caused by new microorganisms that penetrate the root canal during the treatments between appointments. Sources, remains of dental plaque or calculus, caries on the tooth crown, leaking rubber dam, contaminated root canal instruments, and contamination by irrigants. Mechanisms as positive agents that increase in redox potential. It has been theorized alternation of the oxidation reduction potential can be caused by exacerbation according to Mathus. Uh, Access, that is increase in O2 microbial growth pattern change from aerobic to anaerobic to aerobic when the oxygen come in contact with the remaining microorganisms. Okay. These are the various studies. This one still a rat. Okay. Granuloma pouch was formed. Subsequent injection of the same irritant, no response. When the new irritation was indicated, violent reaction leading to tissue necrosis resulted. This is a local adaptation syndrome. Okay. Analogous situation in the patient, inflammatory lesions may adapt to irritated and chronic inflammation. Endodontic treatment causes a new irrigation to introduce may get collected, leads to pain and swelling. Okay, experiments by Moran have shown that endodontic therapy may cause a change in the periapical tissue pressure. Whenever there is a okay. Um, in this teeth where the increased periapical pressure, whenever there is a pressure in the apical region, patient may feel pain. During inflammation, chemicals can be derived from plasma or cells. Cell mediators, histamine, serotonin, prostaglandins, platelet activating factors, leukotrienes, and lymphocytins. Histamine, derived from mast cells, basophils, and platelets. Physical injury, chemical agent, antigenic challenge of IgE, sensitive cell cause release of histamine. Histamine acts directly on the local blood vessels, increase the permeability. Cell mediators, that is serotonin, found in mucosa of the gut, brain, and platelets, released as a result of inflammation. Same effect as histamines. Prostaglandins, biologically active substances, arachidonic acid reserved substances. These are the what we say mechanism of action at the periapical lesions. Okay, these are the various this what we say factors responsible for that. Okay. That is physiological. Okay, we'll see the physiological factors. Fear of dentists, dental procedures, anxiety, apprehension, all of the influence the pain perception of the patient and also the reaction threshold. Previous traumatic dental experiences appear to be a great concern. Root canal procedures appear to be especially painful to many because of accident experiences, conversion of others, also the lack of the information. All these included anxieties, incident, the particular painful episodes. Okay, this is the main part that is prevention and treatment. Okay, various treatment regimens have been used during endodontic treatment because etiology is not precisely determined. Treatment seems to be advocated by relief from occlusion so that pressure from opposing tooth does not come on the at opposite tooth. Pre-medication of pulp chamber, that is intracanal medicament. Establishment of drainage. When the establishment of drainage takes place, the pressure releases and the pain relieves. Relief from occlusion for the prevention of pain as advocated by Cohen. However, controlled study by Crick found that it was not more effective than without any reduction. Pre-medication of pulse chamber concept is good and desirable, but not much clinical evidence is there. Establishment of drainage of the exudate is most effective method of reducing pain and swelling. In some cases, exudate is absent or can't be evacuated from the root canal. In this situation, surgical interventions are necessary. After extrusion has reduced, access can be closed temporarily, according to studies of Wien, August and Seltzer. Leaving canal open can expose the canal to the oral flora and may actually lead to the subsequent flare-ups. Intracanal medicaments. Among these claimed to reduce the pain are antimicrobial solutions. Since microorganisms are responsible for the exacerbation, so placement of germicides and antiseptics into the canal should reduce the pain. But this is not the case in most instances. Sulfa compounds have been reported to dramatically reduce the incidence of pain. Corticosteroids. Action is mainly by the ability of retard the lysosomal release from the cells, prevent the liberation of arachidonic acid from the phospholipids of the cell membrane, appear to inhibit the formation of LTs. Many reports also state that when placed in the canal, pain can be reduced successfully. Calcium hydroxide therapy, when used as the intracanal medical, reduces the bacterial colonies and their byproducts. This can be achieved in case calcium hydroxide is left in the canal for at least 1 week. To leave or not to leave teeth open. When teeth is open for the treatment, exudate comes out. Patient is instructed that their tooth be allowed to drain for 20 minutes. Later, all the teeth should be closed temporarily in order to prevent the contamination from the oral cavity. Teeth left open are more frequently involved in mid-treatment flare-ups. Leaving the canal open to the oral cavity may increase the chances of periapical cyst formation due to the bacteria present into the oral cavity. They may get invaded into the canal and the periapical infections may take place. Antibiotics have been used both locally and systematically in the anticipation of the pain reduction. Should be used only when there is a cellulitis, fever, malaise or toxemia. Overuse of antibiotics can lead to risk of hypersensitivity and anaphylactic reactions. Penicillin is the most commonly used antibiotic based on the predominance of the penicillin. Sensitive microorganisms reportedly found in the infected root canals. Analgesics. Uh, Non-narcotic analgesics relieve the pain without altering the occlusion relative ineffective in the severe pain. Example, aspirin, phenacetin, acetaminophen, prophylaxis, and NSAIDs. Action is primarily in inhibit the prostaglandin production, relieve mild to moderate pain. Aspirin has both anti-inflammatory and analgesic action. Action is based on the inhibition of the cyclogenase pathways. Example, aspirin, ibuprofen, and phenobarbital. Narcotic analgesics, most potent analgesics, they control the pain by reacting with the neurons of the brainstem, spinal cord, cerebral cortex. Primary act by controlling the reaction in pain, that is the increase in the threshold of the pain. This is nothing but the mechanism of action of the narcotic analgesics, that is morphine, codeine, mifedrine, and prophylaxis. Placebos are pharmacologically insert substances that don't have any therapeutic effect. Then next is acupuncture can be used as a dental analgesic with good success rate in a number of procedures, but is not practical as routine procedure for the clinical endodontics. These are the various references. Okay. In the game of root canal treatment, we are not aware of the results of the match that play with the opponents to have win. We should never underestimate our opponent and should always be prepared for the strike. Our knowledge of the cause of the preventive measure that we can only help us with the complete support, faith, and the patient on us. Okay. Mid-treatment flare-up is nothing but the patient getting the pain or any swelling, um, pain, any swelling, or any uncomfort during the treatment. Because in some of the cases, root canal is not the procedure which can be completed into the single visit. Some of the cases need the multiple visit treatment. And the pain occurred during this treatment are known as the mid-treatment flare-ups. We'll see just summarize our representation. This can be achieved by proper degradation, avoid overfilling, avoid extrusion of the your debris from the canal to the periapical regions. Okay, according to Seltzer, uh, there are four main causes of these are the four main causes of the mid-treatment flare-ups, and many more causes can be there, because the breakage of the instrument, or your ledge formation, or your vigorous or over instrumentation, which causes the damage to the periapical lesion, and swelling and pain may occur over there. Then again we can see this extrusion of the debris. When the extrusion of the debris to the apical foramen takes place, debris contains various microbial flora, or various means much bigger load of the microbial load that goes into the periapical lesion, and that tends to grow into the pus cells. This pus may occur over there. Have you seen this one fish zone of contamination, and this one Conford mountain pass theory? Okay, these two factors will properly explain what happens when the extrusion of the this one debris takes place into the periapical lesion. Okay. Over instrumentation. Over instrumentation, nothing but is referred to the when your instruments goes apically to the apical foramen. It causes the irritation. It causes the continuous irritation to the periapical lesion, which will lead to the healing process of the periapical lesion. In that, the swelling, or what we say, this calor, dolor, rumor, over this takes place. Nothing but the rationale of endodontics. Overfilling. If the our instrument, this one, our filling material extrude to the with a desired size or desired length, then it may also cause the irritation to the periapical lesion, and it may lead to the pain and swelling to the patient. Okay. Then next one is retreatment. Retreatment, when there are various failures of the root canal treatment due to any of the region, then retreatment, we do the retreatment, that is re-root canal. While doing this, there is various procedures. We should first remove all the permanent filling made into the or the core builder. Then the gattapacha are removed, and a proper examination of the canal is done. It is whenever there is a need of the retreatment, 99% of the cases there is a pus formation, or bacterial load is increased into the canals. At that time, the proper cleaning and shaping of the canal should be done, and the proper intercal medicament is to be placed into the canal. Okay. And various periapical lesions, as the radicular cyst, or abscess, or what we say granuloma. This leads due to the various factors, such as microbial load and various mechanical factors by the operator. Okay. And I told about the treatment of the this one mid-treatment level, what can should be done. All these treatment are supported by the medication, various medications as antibiotic coverage, and analgesics are prescribed. Uh, okay, fine. Thank you. This was a short topic about the mid-treatment flare-up. In next session, we'll see pulp and periapical lesions. Okay, thank you. Any queries? Hello.
No, sir.
Okay, fine. Thank you.